Is there anything that you'd like to see done that isn't being done to try to increase the number of physicians in general and of family practitioners particularly? Is there anything other states are doing that you'd like to copy?
Well, I think there's a couple things that we have to try to understand is what we're doing successful? Are we getting value in terms of the almost $1 million we're spending as a state in terms of loan repayment? And so I think we need to carefully and critically look at our programs. I think that in addition, we need to capitalize on our opportunity here in Vermont, which is we're creating a new healthcare system. I think we should, and I think it will be likely, our intention is that it's a better place to practice. So we have to establish that brand and we have to market that brand.
Well, now that's interesting because there are those who say, and there was a poll of questionable validity, I'm sure you know what I'm talking about, that indicated that 1/3 of the existing doctors in the state would consider leaving if we went to a single-payer plan. Now, the law that's passed is not really, it does not specifically call for a single-payer plan. But are you suggesting that even if some people might want to leave, that other physicians around the country might be attracted by the direction Vermont is going?
Oh, absolutely. So if you look at the demographics, so physicians are changing. And clearly, physicians of my generation would be less welcoming to a single-payer system. But as far as I know, medical students overwhelmingly support a single-payer system.
Right.
And that probably roughly half of the physicians in practice today, depending on which poll you use, nationwide support a single-payer system. Because when you spend all of your time in a system which is clearly dysfunctional in terms of how you practice medicine and get so far away from why you went into the profession, I think it's really easy to see how has to be something better.
And you say the medical students tend to support the direction that Vermont is going.
Yes, I know that the American Medical Student Association has a platform which supports a single-payer healthcare system.
And so, so you think that the direction we're going could attract more physicians to the state?
Absolutely. So I think a lot of it, the onus is upon us to do it right. So if we do it right, and clearly there's a lot of work ahead of us, I think we can potentially, my hope is that we'll create a place that people will want to come to, whether you be a healthcare provider or even a business.
And is this department, I mean, I assume the answer here is yes, this department is consciously working on figuring out ways to attract people here as the system changes?
Yes, yes. So that's part of my charge is to monitor workforce, but also make changes necessary to ensure that we have an adequate workforce in the future.
And is there a particular sort of subdivision of the department that's doing that?
We have an Office of Primary Care and Workforce that is actively working on those areas.
Are you confident looking ahead that we're going to make progress in this area as far as getting the shortage down? Well,
I would say it would be. I would be overconfident to say I was confident. What I would say is that we've had an issue and a problem with workforce for years. This will continue. I think the uncertainty makes it more challenging in some respects, but also makes it more potentially solvable if we create a system that works very well for providers.
But you're not saying that there won't be, for the next several years, situations in which out in rural Vermont, a person who gets hurt, for instance, and needs emergency surgery, may take a while, may have trouble finding someone, or the patient may have to be medevaced to here or to Dartmouth, or...
Well, I think those issues happen today.
Yes.
Not to a great extent, and I don't foresee that they're going to be instantaneously resolved. But I think we'll continue to monitor this very closely. I think in all of the bills that have passed, there are workforce segments in terms of evaluating, who's leaving, who's coming, how can we optimize the workforce that we have. And so it's clearly an issue that we'll pay attention to.
And I guess what a lot of people, especially mothers, parents in rural areas, are going to worry about whether there will be enough providers for their children, both in emergencies and in normal, regular, day-to-day care. And is that something that they are right to worry about?
Well, I think as a parent or as an individual, I think we should always be concerned about that. And certainly when you look at livability and places that people want to live, having adequate health care is a big criteria that people
Right.
use.
In other words, it's sort of an economic development
Yeah.
matter also. If an area has enough good physicians,
Right.
it will attract more people.
Yeah.